I'll start off with the first question. So the first question is, why don't you give us a quick introduction about yourself and how you got to where you are today?
Can be a very long story, but I'll try. So I'm Dr. Ruchi Bhabhra. I'm currently an associate professor at University of Cincinnati College of Medicine in Division of Endocrinology. Um, so the journey, I would say, was rather a long one for a few reasons. One, because we took a path of PhD with the clinical training, and part because we did our training in two different countries. So I finished my MBBS, which is an equivalent of MD here, so basically medical school in India, and moved to University of Cincinnati in 2001, and did a PhD program in pathobiology and molecular medicine. And it was a good 6-year long experience, but totally worth it. I honestly did not know if I like basic science, but I loved it, and so I continued with my PhD, and then after that, moved on to finishing my clinical training, and finished my residency here in Cincinnati, internal medicine. Then moved on to my fellowship at University of Virginia, Charlottesville, for endocrinology fellowship. And after that, came back to University of Cincinnati as a faculty in endocrine, and that's where I am.
All right, perfect. And for our next question, could you give us a description about your day-to-day experiences in your field and what a normal day looks like?
Sure. So if we are talking academic medicine, which is a completely different kind of experience and routine. So it basically, and this is why I like it too, it involves a mix of seeing patients, doing inpatient rounds, teaching, presentations, talks, some clinical research. So it's a mixed bag. So a routine day would be, so it really depends on how much clinical responsibility someone has, and everyone has different. So my clinical responsibility is almost, I would say, 90%, which includes teaching, and the rest of the 10% is clinical trials. So, like any endocrinologist, most of our job is outpatient heavy. So it is basically one clinic a day, with or without an endocrine fellow who comes to rotate in the clinic. Sometimes we get medical students, sometimes we get undergrad students from the UC pre-med program. So the clinic is part teaching and part seeing patients. And then it could be, if you're on call, going to the hospital and seeing patients in-house. And if at all you have a clinical trial patient scheduled for that particular day, you might have to hop on there to kind of take a look at them. And the rest is presentations and talks, and that depends on the day of the week.
That sounds good. Okay, so the next question is, in your experiences, are there any major challenges you had to overcome? And if so, what are they and how did you overcome them?
So you mean right now in this current position?
Yes, sure. We can talk about that.
So if anybody out there starts thinking of practicing endocrine in an academic setting, you have to be mentally prepared that you have to give in way more than what you will get out of it. That's one. So, for example, on paper, I might be these many hours, but I end up doing these many hours because all of that is my time. So you have to be absolutely like passionate about it, and you have to love to do it to, sustain yourself and to like doing what you're doing. So sometimes the challenge is I feel stretched. So in endocrinology, I think it's unique to our specialty that you are in clinic with the patient. That's that time. And then before and after, for that very patient, you have to put in a lot of other time because the labs come in, the follow-ups happen, the follow-up questions happen, because this is a chronic care specialty, right? So you're mostly taking care of patients with chronic medical problems. So sometimes the challenge is that you're stretched too much catching up on those follow-up things, especially because that time is your time. That's nowhere written in your contract or in your job profile or anything like that. But I would say for endocrinology, especially, it is a specialty where you have to like talking to patients and creating those bonds and long-term relationships. And academic endocrinology if you like to teach. And so those would be, and so if anybody's looking for something like that, and then it's more outpatient based. So if someone thinks that for my quality of life, outpatient based specialty works better than inpatient, so this would be a good one. And it is quite scientific, I would say. So endocrine is one specialty in internal medicine where, you can make sense of every single lab. So if this happens, that happens. If that happens, this happens. It's a very much a physiological specialty, so to speak. So I think I kind of mixed up two questions here. I told you the things I have fun with in endocrinology, but yeah, the challenges are most of the time in academic endocrinology about stretching your time between different responsibilities, and that's all your time.
Mm-hmm. And yeah, you actually did answer part of our next question in there, which was right before we get to our student procured questions, what other information, I guess, do you think high school students should know before committing to this career path? And by that, we mean medical in general and specifically endocrinology.
So I would say for anyone looking for a career in medicine, endocrine or not, you have to be passionate about it. You have to absolutely love it. You should not shy away from hard work. And it's a long career path. So it's like slow and steady. So it's not one of those career paths that you're done with a degree in 3-4 years and out there making money and things like that. So you're in there for a long haul. And if you are mentally prepared for that and you're passionate about it, then that's it. That's a great career path for you.
That sounds great. Okay, so these are the questions that our members asked. So the first question is, how did becoming a professor change the way you've reflected on your medical school experiences?
So that's a little bit of a tricky one because my medical school experience was in India. So I don't think I can quite relate it to medical school experience here. But I have always liked teaching, and I think that's likely because my dad is a professor in India, Hindi literature professor, and so I've always been more inclined towards it. But I loved biology and science and medicine too. So teaching, I think, sort of came naturally. So a big part why I thought I would be a professor or an academic career is teaching and interacting with fellows and residents, and yeah.
All right, and for our next question, what gender and racial disparities have you noticed in your field, and how have they impacted your experiences?
So I know, you keep hearing about this, unfortunately, all around you. And I often sit down and think about, okay, have I experienced this ever? And honestly, I have not. Thankfully, I have never experienced either a racial bias or a gender bias. And I could speak to both because I'm obviously an immigrant coming from India. So but of course, it's there. It's there in medicine. You always hear about gender inequality in terms of pay grades. So it's very well known that across all specialties, that women are paid less than male physicians. And there's some funny stories related to it. Not quite funny, but just to. So I've heard one of my cardiologist friends, female physician, saying that there was a patient one time. She's an interventional cardiologist who said that, oh, if it's going to be this woman putting a stent in my heart, I don't want it. And yes, there were some physicians, and this happens quite often. Have not happened with me, but if you are a female physician in an outpatient setting, the patients often confuse you with the nurse, so you may not be surprised that sometimes they mean well. They're not like trying to demean you or anything, but they will be like, so nurse so and so, so you have to kind of tell them that no, this is, and that sort of is this mindset in a lot of people's minds that maybe the male physicians are better, or the female physician is maybe more like a nurse, and so on. And this is more of a general overview of things I've heard and read about, but I have never experienced anything.
Okay, so the next question is, what were some things you had to give up or miss out on while you were studying medicine, and which parts were or weren't worth it?
So it is true that you have to put in a lot of hard work in medicine, and there would be times that when your family or friends or other people you feel like, oh my gosh, they're really enjoying life. What am I doing? Sitting here just buried in my books. But at the time during medical school, the drive is so much, you're driven, you're learning so much, the learning curve is so steep. So I think that sort of kept me going. There was a lot to study, yes, but there was so much to learn, in the process. And so that drive sort of takes you through it. I would say the things I had to give up, like most medical students, is trips with your family sometimes, and socializing, or but I would say that at least, even if you're super busy with studies and everything, and keep some time for yourself, and do something that you like, even if it is once a week, even if it's for a little bit, because that's extremely important. So I loved to sing, so I used to always have that sort of on the side. So be it hiking, be it painting, be it music, the instrument, whatever it is, just keep that element going, just so that you have that out, and that helps. But for the most part, there'll be so much to learn. You will be quite driven to get through the whole process and the hard work and everything that comes with it. And it'll be totally worth it.
All right, for our next question, what is the most challenging yet rewarding aspect of working in endocrinology?
The rewarding experience by far is the relationship with patients. Like I said, once you start, so imagine the patients you see in endocrinology, right? Thyroid, diabetes, adrenal, pituitary. I specialize more in pituitary, so I see those more. I have hypopituitary patients. So once they establish care with you, they're your patients, you get to know them, about their families, about their trips, and you just create this bond. So I would say that is the most rewarding experience, in my opinion. And the other thing was the challenging part, you said? The flip side of that is then, this is, like I mentioned earlier, one of the specialties which needs a lot of time commitment before and after a visit happens. And I'll give you an example. So sometimes you'll see these patients who have been to Dr. A, B, and C, just trying to find answers. And sometimes you will get the stack of records to go through. So that happens before the visit. Then a lot of testing, the way we do in endocrinology, especially for my pituitary patients, for Cushing's disease, for acromegaly, you really have to sit down with them during the visit to explain everything to them. And once they leave the clinic and they get labs, they get lab 1 and you follow up with them. Okay, next step, lab 2. Because a lot of time these diagnoses, they need multiple investigations, except like thyroid is very kind of straightforward. But so that's one challenge. And the other is, unfortunately, the way the health system is set up right now. We are crunched on time. So you have to see a patient in so and so time. And I honestly feel that rather than being a generic time division across specialties, it should be specialty specific. So for example, maybe a cardiologist can see a patient in 10 minutes because they don't have much of a history taking part. But if it's a rheumatologist or an endocrinologist, I mean, you could spend 30 minutes just in history taking an exam and everything. So how is it that you could see that patient in 20 minutes going through their history, their prescription refill requests, their lab investigations? So we are all crunched in time, and I really hope that in future going forward that changes, because that does affect quality of care sometimes, and there's a stretch on everyone, patients as well as the doctors. So
yeah, that sounds good. So, okay, if you had to go through the whole process again, would you change any part of it or would you keep it the same, and why?
good question. I think, sorry, Vanshika, I'm just getting this thing that my computer, while I thought is getting charged, is not getting charged. Give me 1 second while I charge it, okay? Okay, we're good. So the one thing I would change, I think I would have liked to include some sort of management degree into my training going, so I don't know if I should have put in that much time in PhD versus actually also getting some sort of health management or hospital management kind of training. And the only reason I say that is sort of brings me back to the same point that all these decisions that are being made, how the healthcare should be run, the number of patients to be seen, the time limit that they should be seen, and so on, the decisions are not made by physicians. And I feel like if there are physicians in those positions where they're also doing the management and the admin and everything, it would make a huge difference in how these policies are formulated and how the systems in place are in the hospitals. So I would say if I could do that, that would have been really good.
Yeah, I'm really glad that you've gone into depth about the flaws of the healthcare system because we don't get to talk about that a lot in some of our other meets. So I'm glad that you're highlighting that as an issue. So our viewers watching this, please take that to heart, maybe help make some change. And
right. And I think I just want to add that any job you do, medicine or no medicine, will have its challenges, right? So none of your career paths will be like a bed of roses. You will have challenges everywhere. But so what I'm telling you about healthcare shouldn't change your opinion about being a physician. I mean, if you're passionate about it, you will love it. I love it. I mean, I love seeing my patients, but like any career path, this is one challenge in the healthcare system, which is again unique to different specialties. So when you're going forward, and let's say you opt for a surgical specialty, for example, you may not have any of this issue that I just told you about, because all of your time commitment is procedures. And so in healthcare, basically, whoever is doing procedures, nobody is overseeing the time or the constraints or anything like that. So that the experience can be very, very different depending on which specialty you're in. But don't let that change your mind if you're really passionate about being a physician, because like I said, any career path will have its challenges.
Exactly. All right, and speaking of challenges, for our next question, in your field, what are the most significant changes caused by the COVID-19 pandemic, and how do you think it will affect our generation's experiences?
So I will first talk about endocrinology specifically. So like I said, endocrine is an outpatient-based practice mostly. The advantage of endocrinology over specialties like rheumatology is we don't have to depend on a physical exam as much as other specialties, right? So if you think about it, for an endocrinologist to get the gist of the story, they need the story. So the history is the most important thing, and the numbers, the labs or the blood sugars and the investigations. If you have those two elements, you can pretty much get through your the visit. So that made telemedicine an easy thing to do for us. Of course, there are times in specific conditions like a diabetic patient with neuropathy, or a goiter, or a Cushing's patient or an acromegaly patient, that the exam is absolutely important. But for the most part, telemedicine worked beautifully with endocrinology. So when the pandemic first started, we were still trying to figure it out. And like all specialties, we had to put protocols in place, train our nurses how to do this, how the scheduling should be done, and how they should be doing video visits and so on. But I have to say, within a month or two, we were up and running fairly smoothly. So the biggest change the pandemic has brought to endocrine and outside endocrine is telemedicine. And there were people who were sort of spearheading the telemedicine idea even before the pandemic, but they were not getting anywhere because the insurances and Medicare and Medicaid wouldn't cover it. And now when they all got on board that we will cover a telemedicine visit, it's becoming more and more and more common. And outside of my experiences, from what I've heard, it's getting into patients' homes now, which is absolutely amazing. So there are organizations out there that are doing, so there would be, let's say, a nurse who will go, or a nurse practitioner go to the patient's house, so that person there can do whatever exam you want. Rest is blood work and history, and you can actually finish this whole visit, electronically, with the patient they don't even have to step out of the house, which is especially good for patients who are elderly or have difficulty getting in the car or driving, or if they're coming from like long distances and find parking, so it just takes away all of that. So yeah, so that would be the one thing that came out of the pandemic, which I think has completely changed medicine. And this is going to stay. Telemedicine is not going away.
Okay, so I have a question. So you said you went to UC. So could you tell us some experiences about it? And you also went to UVA. So if we could hear about some of those things, that would be great.
Sure. So UC experience was more as a student. So my husband and I, we came from India on a student visa, is what it's called. I'm sure your dad came on the same visa, Anshika. So we actually met there. So we came on a student visa, and it was some sort of cultural shock, some sort of social shock because obviously you're coming from India to a new country, and there's a lot of stories that I find amusing that from our experiences. For example, I'm sure you can relate to it because I've seen my son doing it too. He's 13. That I found it very odd that people could eat in the class, right? So in India, that was like no, I mean, if you could not even imagine. And then there were things like calling your professors, especially during PhD, by their first name. There's no like last, so most researchers, nobody calls Dr. So-and-so, they're all on first name basis. So it got us some, it took us some time to get used to that. So there were a lot of these little cultural shocks, so to speak. But what I did like about my training here during PhD was how much emphasis there is on your own thinking. So you formulate the thoughts, you formulate your opinions. What do you think? I mean, so you're really doing all that thinking on your own. There's no spoon feeding, is what we called it in India, and so on. So I liked that part. It really changed my outlook and how I grew over all these years. And then the experience in UVA was very different because by that time I was much ahead in my career. So UC was more a PhD student versus now I had done my residency and I was an endocrinology fellow. And we loved Charlottesville as a place. It's beautiful. And University of Virginia campus is lovely. I don't know if you've had a chance to go there, but it's beautiful. And the part how UVA is related so closely to history and Thomas Jefferson was kind of cool. Monticello used to be like literally a 5-minute drive from our house. And the training at UVA, so I will say that my residency was in a community hospital setting because of visa issues and long story. But so a community hospital setting residency versus a university hospital setting fellowship was a big switch. And I got to train from some of the internationally known professors at UVA. So the pituitary clinic at UVA is a tertiary center where we got patients from all over the world. And so that was really amazing. I was fortunate to get trained by such experienced and very well-known professors in their field.
Speaking to what you just talked about in your fellowship experience at UVA, what do you think are some primary aspects that make a strong fellowship program?
So I can talk in context of endocrinology fellowship, and some of the aspects should apply to other fellowships, but I guess not all. So one is that how solid is the faculty, meaning in terms of their experiences, in terms of their research, because after all, you will be trained by them. You will learn from them. So that's one. The other is, especially for endocrinology fellowship, so within each specialty are subspecialties, right? So for example, in endocrine, there is bone, thyroid cancer, adrenal, pituitary, diabetes. So you should have a program where different faculties have their different interests. So you could actually go and train in these subspecialty clinics. So you have a bone person you can go to, you have a thyroid cancer person you can go to. Because if that's the case, you will get this very wide overall training and experience, which will stay with you. So that's all about the training. Then the third thing is, what has the fellow's experience been there? And you could, when you go to interviews, for example, that's what you want to know from the fellows there currently, that how's your experience right now on day-to-day basis. Fellowship program should be one that listens to the fellows and their feedback and make changes based on that. And the fellowship program we have here at UC does an amazing job at that. My program at UVA was great at that, because our program director would listen to us, and not just because he has to put something on paper. He would genuinely listen to us and try and make changes to make the fellows happy, make their training worthwhile. So that would be the third element I think a fellowship program should have. Absolutely.
That sounds perfect. So these are all the questions we had from our members. It was really great hearing about all the advice and experiences. Sounds really cool. And I have to say, my school that I go to 2 schools, and the STEM school I go to, like the campus is based off of UC's campus. So
Oh, really?
yeah, they got inspired by it. So it looks very similar in that way. But it was really great hearing about your experiences. We're so glad you came. Is there anything else you want to tell us, your experience?
I just want to end by saying that good luck to everyone out there. Follow your passion, work hard, give it your 100%. And at some point, after all this hard work is done, you will sit and look back and you will not regret it, because you like it so much. And that rewarding feeling about seeing patients will make it all worth it. So
Thank
good
you.
luck to everybody. And thanks for having me. It was
Yes,
fun
it
talking
was
to you.
great.